Welcome to Soul Conversations with Z, Healing in the Raw, where we keep it raw, real, and unfiltered. I'm Zachyra Rodriguez, a trauma specialist and marriage psychotherapist, and this is a space where we dive deep into the messy, yet beautiful and often difficult parts of life. Here we challenge ourselves to face our fears and dig deeper into self-discovery. I'm no newbie. I've navigated many rocky roads and consider myself a recovered traumaholic. Life hasn't been easy, but I truly believe that everything happens for a cause greater than ourselves. Whether you're navigating with grief or grappling with trauma, healing from attachment injuries, or working on your marriage, we're here to unpack it all. No sugarcoating, just honest conversations about the struggles we face and the growth that comes from them. You matter, you are loved, even before your existence, and you're created to do great things. So grab a seat, my friend, take a long, deep breath, and let's get real together. So let's begin.
Hello, everyone, and welcome back to Soul Conversations with Z. Today, we're having another exciting episode. This has been a long time coming. It's been in the works. We've been talking about it ever since COVID actually started. I know that our special guest, Rowena Moore, she and I have spoken about so many times about getting together, and we're going to be actually diving into a great topic today, and it pretty much has to do with speech and trauma. And what happens when trauma actually steals, a child's voice? And we're going to be talking about the connection with both of them. So I'm going to turn it right over to our guest today, Rowena Moore. So tell us a little bit, actually, Dr. Rowena Moore. So tell us a little bit about who you are and what got you here today.
Well, first of all, it is a pleasure to be here. Thank you for having me.
Absolutely.
We have talked about this for a very long time.
We have.
And here we are today. So I'm excited to be here to talk about some topics that are near and dear to my heart.
Yeah.
So I'm so grateful.
Yes. So for those that do not know, Rowena and I, we pretty much met during through church,
Yes.
right? It was first through church. And Rowena is actually an identical twin. So funny story before we even jump in. Rowena, her name is Rowena and her sister's name is Rowan. And I didn't know who I would be talking to until they actually started talking about the topic. So when Rowena would actually talk about speech therapy, I knew that she was referring to my son, and we'll get into that in a little bit. And then when I was speaking to your sister, because she also, right, is a licensed clinician, then I would know like, okay, this is she's the therapist and you're the speech therapist. So that was pretty interesting to actually know a little bit about you as far as like, okay, well, who's who? That's how I used to actually figure it out, like who's who. So let's dive right in and tell us a little bit about, who you are, your background. I know you are, Dr. Moore, and you've done so much work in the community. You and I are, we also do ministry together as far as that goes. So tell us a little bit about your background.
Okay, so I come all the way from Trinidad and Tobago.
Trinidad, yeah.
And I've been living in the United States for over 30 years.
Okay.
I started off initially when I came doing my degree in elementary ed and special education. And I had moved to Missouri, first of all to Miami, and then to Missouri, and then to New Jersey. So my background in terms of my family, as you said, I am a twin, identical, and I do have two other sisters and a brother. And my sister's younger and my brother is older. So there are a total of 5 of us altogether. And I guess I have backgrounds in different things. So elementary ed, special education. But before I left Trinidad, I also did my diploma in Christian education. So I went to Bible school.
Wow.
And recently, I went to Rutgers and did my certification in trauma and crisis intervention.
Wow.
And I also completed my diploma in counseling and biblical counseling and psychology. So
You're a
I have
busy
a
lady.
wide range of
You're a busy lady,
backgrounds.
yes.
But where I land primarily is in the field of speech therapy. So I call myself a trauma-informed speech language pathologist.
I love that. It's the first time that I'm actually hearing that title.
Yes.
Wow, that's amazing. So where did this passion come from as far as, working with children, working as a speech therapist? I know you and I were talking a little bit earlier, and one of the things that you said, you kind of like landed into this profession, and that happens to a lot of us. So, help us understand, how did you end up as a speech pathologist?
So I started off wanting to help children with communication issues.
Okay.
So I went to school. I decided to work on my degree in special education and elementary education,
Okay.
but I still had a heart for helping children who could not speak. So one of my classes was an introductory class to speech language pathology. And when I took that class, the light bulb went off
Wow, it
in
was
my
like,
head.
this is what I'm supposed to be
This
doing.
is what I'm supposed to be doing.
Wow.
And years later, I did contact that teacher to let her know that I landed in the field of speech language pathology.
Wow, because of that one class.
Because of that one class,
Wow.
I got there. So it was sort of a background way to get there, but I got there.
Oh my goodness. I love that story, because normally like everyone has like their path as far as like, how did you even land there? And just hearing like all the background that you have as far as, having like special ed education and all these different things. It's like, oh my goodness. It's like everyone gets to this like one path, but getting there, it's like so many little paths in order to arrive.
Yes.
And was there ever a time that you decided, or you knew from the beginning, that you wanted to work with kids and, or adults? Was there any, specification that you had?
So I think in Trinidad, again, we went to a field trip at a school for children with deaf children who were deaf. I don't know why someone would take children to a deaf school, but that was our field trip. And from that moment, I realized that there are children out there that need help communicating. Wow. So that sparked that desire in my heart to work with children who could not communicate. I didn't know how to get around doing that, but I knew from that experience of going to the school for deaf children that was the path I needed to take. Again, I took a roundabout way. I went into special education and elementary education, but I eventually got to speech pathology.
Wow. Now, you did your speech pathology here in the U.S.? Or?
Yes,
okay,
I did.
So all that education was here.
Yes.
Wow. So let me just ask you this. So when you're seeing like different kids and stuff, or you're around different children, is that easy to pretty much, kind of like point out like, they have a speech? Because people ask me all the time, like, is there ever a time like how do you like turn off the brain, right? As far as a lot of times we hear people saying like, you're psychoanalyzing me, right? So for you, like you're in a crowd with all these different children, right? Is that something that you kind of, point out right away?
Absolutely. It's very hard to turn the switch off because I'm aware of what a child who has a disability, looks like, or communication impairment. So when I see it, I point it out right away. I remember a couple of years ago, my sister and I were at a certain location, and a child walked up to the stage, and I noticed that the way in which she was acting, the way in which she was moving her body, and the way in which she was looking at people, I knew right away that she had autism. And I turned to my sister and I said, that child has autism. And my sister said, oh no, she's just a toddler.
Yes.
And years later,
right,
or even a few months later, we found out that child did indeed have autism.
Wow.
So it's very easy for me to sort of identify, children with disabilities. And of course, when a child starts speaking, I can identify if they have like an articulation errors, or if they have errors, or if they have difficulty expressing themselves. It's quite easy to point out.
I mean, it's a great thing. Do you just go up and just point it out to the parent, or?
That's very hard. That's
Your
very hard
child,
to do.
yes.
No, I do not. I don't know
Okay.
that parents would appreciate that.
I don't think they would not. Yes,
No.
I don't think they would. Okay, so let's try to understand, like, like speech, communication, like what does that actually look like? So many parents think that speech therapy, it's about like how you pronounce words, right? The child is young, they're learning how to, talk. So what are some of those like deeper communication challenges that you start to see like that children start to experience at a very young age?
So, of course, everyone identifies the communication impairments as a speech articulation
Yeah.
error.
Yeah.
However, there are different facets or areas of communication that we don't always talk about. So, one of them is your ability to express yourself. So,
Right.
if a child has difficulty using vocabulary, putting words together to form sentences, understanding grammar and using it appropriately, that's all part of speech therapy.
Okay.
Sometimes children have difficulty with comprehension, so they may have difficulty with reading comprehension or listening comprehension. Some children have difficulty following directions.
Yeah.
And those are all areas that we work on. We don't always think as well about voice, but that's a part of speech therapy.
Wow.
So for children who
so
play
elaborate on that.
sports, or for children who yell a lot, sometimes there are these nodules that grow on their vocal cords and they may become very hoarse and have laryngitis. So we also work on vocal abuse therapy and voice therapy. Sometimes there are pathologies like medical issues that may cause a voice issue, like vocal paralysis. If you have a surgery, sometimes that might impair your vocal cords, and
Right.
your vocal cords can actually get paralyzed. So we work on different aspects of voice therapy as well.
So how old does a child have to be for them to get assessed for, some type of diagnosis that they have been, having regarding speech?
So children, you will notice based on how children are developing if they are not following the milestones.
Okay.
So as soon as a parent notices something is not right, you can actually get an evaluation. For example, if a child has difficulty with feeding and swallowing, which we didn't talk about, but that's another aspect of speech therapy. So if a child is not able to swallow, they're not able to suck properly on the breast, they're not eating, they're drooling, you can start working on those issues when it happens.
So as young as a baby?
As young as a baby, absolutely. There are babies in the NICU that are working on feeding therapy with a speech pathologist.
Wow.
Absolutely.
Oh my goodness.
Yes.
Yeah, that's completely new. So I'm going to share a little bit about my own personal story with speech and how it affected our family. So when Anthony was little, and many of our the audience and our listeners, they know that, we lost Anthony a few years ago due to an autoimmune disease. So when Anthony was about, I want to say he was about maybe 2.5 years old, it was interesting because he was talking, but for us, I mean, he's my first child and I'm thinking that he's fine and that he is actually, pronouncing words from here to there. And again, we're a bilingual family, so we're speaking Spanish to him because that was always the dream, to speak Spanish and for our kids to all learn both languages. And when he got assessed, a nurse actually, a family friend said, I think you need to get him assessed because his, pronunciations are not that great. And she was a nurse. And in my mind, I'm like, well, what is it that he actually has? Like he's talking, and we ended up getting him evaluated just because of the fact that we were just like, let's just see. And when we did that, he was having auditory problems. And they said that he had fluid in his ears. And when they did the test, it was like his eardrum was not moving according to how it was supposed to. So he was picking up words, but he wasn't getting the full, understanding, it was not clear. They explained it like it being muffled, like when you're underwater and you're hearing words. So he wasn't really picking up all the correct sounds. that he should have. So that, of course, took like years as far as like him getting, tubes in his ears and speech therapy as well for a few years in order for him to actually, be pretty much discharged from that. But it was a difficult season. It was a difficult season because, again, you're like, oh my goodness, like, is he going to speak? Is he going to be able to do great things and have a normal conversation? And it was difficult even having him in daycare. So it's just so interesting just to hear how, like, even earlier than 2.5 years old, that you can actually, go through this process.
Absolutely. Yes.
Wow.
And it's great that you listened to that nurse, because sometimes people see what we don't see.
Right.
So it's very important when someone points something out for you to take note, at least
Mm-hmm.
investigate, and don't just
Mm-hmm.
ignore what someone is saying,
Yes.
because it could certainly be something that needs to be taken care of.
Yeah. So what are some of those early signs that you would actually maybe tell parents that maybe they can kind of, look out for?
Sure. So the signs start from birth.
Yes.
So 0 to 3 months.
Mm-hmm.
If a child is not smiling, they're not engaging with you, they're not cooing.
Yeah.
You notice something is wrong,
Okay.
Why isn't this child smiling back? Because if you look at a baby looking at his mom, you could tell how engaged that baby is with the mom. But if a child is not doing that, they're looking away, they're not engaging when the mom is talking to them, that is a big flag, 0 to 3 months old.
Wow.
So you can start looking for these cues as young as that age. If they're not babbling, they're not even saying sounds, putting mama, dada, those early sounds are not occurring.
Yeah.
That is a big red flag. And as they get older, they should be doing certain things like waving by the time they get to 1 year, blowing kisses. All of that is part of social communication and development,
Absolutely.
which is another area that we work on, those social skills. So you pay attention. Are they starting to say words, starting to say sounds? Are they using 2 words together? By the time they're 18 months, they should be combining words. By the time they're 2 years old, they should have a vocabulary of at least 50 words.
Wow,
So
2 years old.
You should be looking at those developmental milestones to identify how a child is progressing. And as they get older, are they having difficulty with reading and writing? All of those are red flags for language.
Okay.
Then there are other red flags in terms of articulation you need to look out for, because by the time a child gets to 3 years old, they should be saying those lip sounds, the b, the p, the m, the h, the w. All of those lip sounds should be coming in, and then some of the other sounds, the K's, the G's, the F's. So it's important to know what the developmental milestones are and to track how your child is progressing.
And it's unfortunate because parents do not know this.
Right.
They don't know if a child is actually developing the way that they should be.
Right.
Because you're talking about a lot of different signs that they should be looking for.
Yeah.
So who sits down and says, hey, there's some challenges or some signs that I'm noticing, and maybe your child could have, issues with speech?
So that information is available online. I always recommend the American Hearing, Speech, and Language Association website. And of course, if you just type in speech and language developmental milestones, you would see a lot of information about how a child should be progressing.
Okay.
So it's available for every parent to actually track how your children are developing.
Yeah. I guess for me, I'm just trying to think about, like, if there's, again, people perish because lack of knowledge, right? So if you don't know, you don't know.
Right.
So kind of like what I shared with you earlier, as far as like with my own personal story, thank God someone saw, the signs that there were some challenges. But imagine a parent that has no idea that, they should go online, because for them, it's like, oh, this is normal. Oh, no, they're just, they're lazy, right? You hear that a lot, especially in, like, in the Caribbean culture or Hispanic culture, as far as they're just lazy, they don't want to talk. So it's just a little bit challenging even for the parents to be able to know what they should actually be looking for. Yeah.
Absolutely. And I think always, if you're not sure, check with your pediatrician, because they also have knowledge of how children should be developing, and just let them know, I noticed that he's not saying words. I noticed that sometimes when he tries to say words, he's getting stuck, or he's just saying a sound and it's just prolonging. Like he can't get the word farm out. He's saying and he can't get the word out. Some children stutter before they're 3 years old, and that's normal. But if it continues, then it's a big red flag that we need to pay attention to.
Right.
So always double check with your pediatrician.
Yeah, that's good. That's really good. Because I guess they would be also the main ones to know that there are some red flags and some signs, happening. And then that's tough too, telling a parent that, your child seems to be having, presenting with some sort of, speech impairment, or, that's another thing. Yeah. How has your experience been with having to tell parents, hey, there's some signs here?
Yeah, I mean, it's not just parents. Sometimes it's people that you know closely, too. It's hard to have that conversation. And sometimes, in my experience, people have listened. And I've personally heard from someone that said, don't say that about my child.
Okay.
So sometimes you get a positive response, but sometimes people aren't ready to listen
that's the word.
to hear the information. But I think when I do evaluate a child and I do have to share information with the parent, you recognize that you could be in that seat. So you sort of take that position of, how would I feel if I was hearing information about my child having this disability?
Right.
So the way that you approach the parent is, first of all, accentuating the positives, talking about what they can do.
Okay.
I notice that they can do X, Y, and Z. However, I do notice that in these areas, they might be a little bit behind. And I think when they hear the positives before the negatives, it prepares them to receive it in a different manner.
Yes, just like in therapy.
Exactly.
Yes. You give a combination of both.
Yes.
Okay, so we've been talking a lot about, these signs. So let's go a little bit more deeper now in terms of trauma. And I know you indicated that you have a certification in terms of with trauma. And what actually, kind of piqued your interest in being like, you know what? Yeah, I want to go into trauma and see how this actually affects also, a child's ability to speak.
I think my interest in trauma started when we started doing trauma groups together during COVID.
So share with the audience a little bit about that.
So during COVID, we had an opportunity to work with the AACC and get our certification in trauma. And we started a class called Healing the Wounds of Trauma.
Yeah.
And it was great in that we were able to, and still continue doing that class, helping people who have experienced different types of traumas in their life. We also had the opportunity together to work with people who had experienced some trauma when our church burned down. So my interest in trauma started in just helping people in general.
Right.
And then I got more and more exposure to other speech therapists who were doing trauma-informed care.
Wow.
And that's when I started doing more certifications and learning more about how do you combine speech therapy with children who have experienced trauma. And it's not just children, it's adults as well that we work with.
Yeah.
So that sort of started my journey into trauma and delving into it.
Again, so many different paths, right? To get to that one main path.
Yes.
So let's talk a little bit about that. And yes, absolutely. We have done so much work together since I want to say 2020 or 2021 when we started doing like all these trauma classes and everything else. And we still continue to do it, which is amazing. But I remember when you were talking about, oh my goodness, I want to do some trauma work. And then you just started and now here you are today. Yeah. Being able to work with children like that. So how does trauma actually impact, a child's ability to be able to communicate? And I know that's a loaded question.
Yeah.
So you could try to like break it down for the audience.
Okay. So how much time do I have to break that down?
Well, we have a little bit. We have a little bit, yes.
So I think it's important to realize that trauma can start in utero.
Okay.
Trauma can impact the fetus.
Absolutely. Yes.
And as the child's brain is developing, the majority of a child's brain develops in utero.
Yes.
So if a parent is experiencing trauma, that impacts the child itself.
Yes.
So studies have shown that children who have parents who experience trauma end up having prematurity, low birth rate, they're colicky, et cetera, et cetera. It impacts the child in utero. Anything that impacts your brain also impacts your learning and your growth.
Absolutely.
So it doesn't start after a child is born. It starts even before that.
Right.
And in early childhood, children who experience trauma at a young age, they have difficulties later on in their thinking, their processing, their memory, and their communication skills. So to kind of break it down in terms of language itself, children who experience trauma definitely have difficulty expressing themselves. So you would find that these children have a smaller amount of words that they know. Their vocabulary is smaller. Their ability to express themselves in full sentences is smaller. So we notice that it impacts even their thinking skills. So their ability to comprehend what you're saying is hard. It's hard for them. Their ability to follow directions, to be able to think through a story, or even to tell a story. Their narrative skills are very much impacted. So you think about a child who has experienced trauma, and they now need to tell their parent, or they now need to tell a police officer or a social worker. Their ability to put stories together is definitely impacted. And what happens to someone who's going through a trauma? Well, part of your brain is disassociating. So you're not able to even remember specific events that are happening or sequence the events that happened. So when you do try to explain it, you can't. So their brain capacity to be able to explain things are definitely impacted. Emotionally, we also notice that children who have experienced trauma also have difficulty expressing their feelings.
Absolutely.
So
and we
they
see that a lot.
have a hard time going beyond basic words. Mad, sad, glad. They're not able to express that I'm worried, I'm bored, I'm anxious. So their vocabulary is so limited that they can't really explain how they're feeling. In order to explain how you're feeling, you need people around you that would support you. And give you the words to describe what you're feeling on the inside. So children need to have that language that matches their behavior and their body feelings as part of their vocabulary development. And if you don't have a supportive environment that helps you learn those things, how can you learn it?
Yeah. And as you're talking, I'm thinking about these, some of the children that they do not have the supportive environments. So how do they even become successful at being able to express their emotions? So we do a lot of work with, kids as far as emotional language and how to be able to develop that even the emotional attunement as to what's happening. And it's difficult with trauma. Like we see it here, So I can only imagine now being able to teach someone as far as how can you actually express yourself, as a child.
We do a lot of work on teaching emotions and feelings in speech therapy.
Okay,
because
so that's also part
of speech therapy.
Treatment.
Yeah, we work on giving them the language to explain their feelings. Because a lot of times they have conflicts with other people, with other children, and they can't express their feelings. They have difficulty on the playground, and when they get back to the classroom, they can't tell you what happened because of their limited vocabulary. And just socially even, we find that a lot of children who have experienced trauma, they also have a difficult time interacting with other kids. Because in order to interact with someone, you must be able to communicate. And their communication skills are impacted because of their trauma. they tend to have a hard time reading between the lines with kids, other kids.
Of course, that's socialization.
Identifying those nonverbal language. Even as they grow older, they have a hard time identifying that nonverbal body language, or even when someone says something that's implied, they don't understand that it's implied. So their response could be aggression, tantruming, shutting down in a social situation, and the other person has no idea why they're behaving that way.
Right.
Well, they don't know how to express themselves appropriately, and they're not understanding what's happening in that social dynamic.
And also parents, I believe, also, they don't understand how the children are actually, you know, like these behaviors, like where are they coming from? Right. Because I'm sure that there are many behaviors that children are displaying that the parent also could be just saying, okay, they're just misbehaving. Right. You know, so do you find also like with parents that they also like misunderstand like the children and themselves?
Yeah. So I think if parents just look at the behavior, but don't think about the background behind the behavior, it's easy to misunderstand when they're tantruming. Sometimes children may be aggressive and they may be acting out, and we see that as bad behavior. You're not behaving. So we look at those things and we misunderstand it. Sometimes children have difficulty sleeping, and, you know, they may just be at a place where they stop talking as well.
Oh, yeah.
So they shut down.
Yes.
You know, sometimes they regress and they start using baby talk. So,
or whispering.
Yes. Right.
That's a big one.
So you could easily misunderstand how those behaviors could be something else and not related to trauma.
Right. And I think that parents sometimes, they do misunderstand, you know, based upon the behaviors, or teachers as well.
Right.
If they're not trained in terms of maybe this is something bigger, right? And children also, I've seen it as far as like the communication stress in terms of not being able to and having the ability. And kids know that, oh my goodness, I can't pronounce this, or as they get older, you know, and then we have now also the self-esteem issues that come into play. But I do believe that it's just so important for parents to be also very much aware that, you know, the behaviors, maybe it's a little bit, it could be something more in depth. Right. Versus just the behavior because the child is just trying to, I don't know, be bad, or they're not listening, like how they say, you're not listening.
Yes.
Right?
Because we want children to listen.
Yes.
So if they're not,
you're bad.
You're being bad.
Yes.
And the child receives that message and internalizes it.
Absolutely.
So you've experienced a trauma, and now people are telling you're bad because you don't know how to express yourself. You don't know how to deal with all these emotions inside of you. So it's a lot for a child to carry. And the adults in their environment need to be supporting them through all of this.
And they may not even have the capacity.
Right. Yeah.
Right. That emotional language or that emotional vocabulary or the attunement to be able to even understand what's happening with themselves. Now think about their own child.
Right.
Because it's just behavior for them.
Yes.
You know, so let's talk a little bit now about these dual languages environments where children actually, they speak, you know, English, Spanish, or another language. What do you suggest? You know, what is your, I know you and I spoke a little bit about this, right? As far as, because we've heard in the past where if a child has some type of impairment, you know, a speech impairment, they should only learn that one language, which is English. So tell us a little bit about that. Like, what is your experience in terms of that?
I think that is what I would call old school thinking.
Old school thinking.
Old
Talk
school
about
thinking.
it. Okay.
Children need to learn or be exposed to both languages.
Okay.
Because your language is your culture.
Yes.
It's the cultural background of the home.
Absolutely.
So to pull that away from a child, that to me is a disservice.
Yeah.
It's important, even if a child has a disability, to expose them to both languages.
Yes.
Because when they're around other family members who speak that language, they should be able to say a few words in that language or understand some words in that language. Now, they may not be completely fluent in their second language, but we must give children the opportunity to learn both languages.
Yes.
Especially for children who may have experienced some sort of trauma.
Yes.
Because like I mentioned before, sometimes they don't have the vocabulary as a child who has not experienced trauma. So sometimes they may have word finding difficulties. So if I don't know a word in English, I might know the word in Spanish.
Right.
And I could speak both languages at the same time to talk about my experience.
So even though it's being mixed, it's okay to mix languages.
Of course.
Okay.
Because if you can't say the word in one language, but you can say it in another language, absolutely, you should be allowed to do that.
Okay.
So it builds that child's vocabulary because trauma reduces a child's vocabulary.
Yes.
So that's very important.
Wow. We're learning a lot, guys. We're learning a lot today with Dr. Moore. So talk to us a little bit about like these tools and techniques that you utilize, or some of them, because I know that there's so many of them, but that you utilize to help, families that are experiencing these type of challenges.
So within my own office, I definitely have a toolbox of lots of things that I use.
Okay.
But I think most important when you're working with children is that you must create a safe space for them.
Okay.
When they come into my room, they need to know that they're safe.
Okay.
They need to know that things are predictable. So I make sure that things are predictable. Because if you don't know what's happening, think about it as a child with trauma. You don't know what's going to happen, or any child. You don't know what's to expect. Then that really interrupts your whole flow of where am I going, what's going to happen, and what are we doing. Everyone needs to know the direction that they're going in. Before we came into this room, we talked about what we were going to talk about.
Yes, we did.
So it's important to know, for children to know what to expect.
Right.
It's also important for you to help them to know that they matter. And that they can choose. So I always offer choices for children.
Okay.
I do a lot of play-based therapy. That's one of the tools in my tool chest. Is to allow children to play, because children learn through play. We learn through play.
Yes, absolutely.
So it's important for children to play, and I always offer them choices. Would you like this, or this?
Yes.
Now, I don't open up my whole closet and say, choose, because it could take forever.
Yes.
But I do give them some choices, because then they're going to be more engaged in the process.
Absolutely.
If they have the choice as to what they're going to do. So you have to allow them to make choices. Also, build trust. Build trust in that relationship. Before I start getting you to speak, you need to trust me.
Right.
So that's an important piece of my whole speech therapy tool chest, is I need to build trust. And I always start my sessions with, tell me about anything you want to share. Now, that could get you into trouble sometimes.
Oh, yeah.
Because one time I had a child
deep question.
I said, so what do you want to share? It's share time. Well, my mom hit me with a spoon over my head.
Oh, boy.
So, of course, I had to report that.
Yes.
I just had to get involved.
I didn't want you to share that part. Everything else except the abuse. Oh, my goodness.
But it's important because
of course,
what that taught me was that child felt safe enough to tell me that. So you have to allow them time to feel comfortable, time to trust you, time to share. And just allow them to be themselves,
Yeah. It's like that rapport building, right? Just like in therapy.
Yes.
And everyone knows pretty much that I'm a trauma specialist. So we do a lot of work, with building trust.
Yes.
Because if we have a client that comes in, there is no way that they're going to just expose their whole entire life in front of us just because I showed up and they showed up and we just said, okay, tell me about what's happening. It takes time, and it takes, a lot of security, a lot of them feeling safe with you, because they're also testing the waters. They're also testing, can you be trusted? Why do I have to open up, or why should I open up to this person sitting across the couch, which I know nothing about it. I know nothing about you, right? All I know is that you're a professional, you're a woman, and you're here to help me. But why should I actually do this? Why? What about you makes me feel comfortable enough? And it sounds like that's what you're talking about, even with the littles. And I don't think that we actually specify. Can you tell us the age group that you normally work with?
So typically I work with children in my private practice that can be any age. And I even work with adults in my private practice.
Yes.
But the majority of the time I work with children between the ages of 8 to 11.
Okay.
So
That's a very delicate age,
It's
too.
a delicate age. Exactly.
Yes.
Exactly.
Yeah.
But getting back to how we do therapy, one of the things that relates to trauma is that sometimes you may notice a child having some emotional issues.
Yes.
So we do incorporate some techniques that you use, such as grounding. If you notice that they might be disassociating or they might not be feeling safe, we do try to do some breathing exercises to kind of calm them down. I also try to be very mindful of my tone of voice.
Yes.
Because if they start escalating,
of course,
and I start escalating,
we have a problem.
Then we have a problem.
Yes.
So you have to try to use a very calm voice to help the child themselves be calm.
Yes.
And I have noticed this working with children who have suffered trauma, that if I pull back and I'm calm, they reciprocate.
Of course, their whole nervous system.
It just changes them.
Yes.
So that's really important. But then we do fun things too in therapy. We do dancing and movement activities, because even dancing and movement helps children with speech therapy. So sometimes we might take a brain break and we might put on Go Noodle or Kids Bop.
Okay.
Any one of those things that could get them moving. We might do it at the beginning of the session.
Yeah.
Midway, if you notice that they're getting a little antsy.
Then you shift it around.
Shift it around, let them move. Sometimes I put up stations in my room so that they can move from one station to the next, so they're not just sitting in one place, or just be on the carpet instead of at a table. So you have to kind of mix it up and be child-centered and child-focused. And read their bodies. It'll tell you how they're feeling. And make adjustments as you go.
It's so interesting as you're talking, and I'm thinking about, you're talking about like the grounding and the breathing exercises and all that. And it's the same thing in terms of like what we do also in our sessions. So it's kind of like you're doing the stabilization in order to begin the treatment. And it goes hand in hand, because we cannot work through trauma if you're not stabilized.
Right.
So most of the time we'll have to go through stabilization in order for us to go to the next step, which is then now when we start to work through trauma, because if not, someone can actually be re-traumatized.
Right.
And we don't want that. So speak to the parent that's out there listening right now and saying, oh my goodness, I had no idea. What can I do now to actually help my child? Because I've been noticing some signs that are popping up here and there. Speak to that parent that's out there listening to you.
So I would say to any parent, if you notice signs that are popping up, get help. If you notice anything that's outside of the norm, it's important to at least investigate.
Okay.
Talk to your pediatrician, like I said before. Talk to someone that's a speech pathologist. Set up a consultation with a speech pathologist.
Yes.
Sometimes consultations are free. I offer free consultations to parents. Get the facts instead of living in your head and just thinking something's not right. I actually spoke with a colleague recently, and he had mentioned that his wife sort of said to him, something doesn't seem right with their baby. And he didn't really pay attention to it at first, until he noticed that when he said something to the child repeated back to him the very same things. We call that echolalia.
Yes, absolutely.
And then he kept paying attention, and he noticed that there was a lot of echolalia going on. And then he listened to her and said, let's get some help.
Yes.
So it's important to look for the signs, pay attention. If you're not sure, there's no harm in getting a consultation and looking into it.
Yes. So it also depends as well on the parents, being open-minded as well, and not just shutting down, thinking that, oh my goodness, something is wrong with the child. And, because there's also fear, as far as like, okay, I want to have, let's just say, a child that has no type of challenges. And then all of a sudden it's like, oh, here we are today. But what is one message that you would like our listeners to take home today as we're getting ready to wrap up?
I would say, regardless of whether a child has trauma or a communication impairment, that does not define who the child is or what the child could be. If you get the services early, that can make a huge difference in that child's life.
And I love that it does not define who they are, you know, because even based on my own experience, I was able to see Anthony graduate, go to school, I mean, sing in the choir, worship leader, and all this, you know, but at the beginning, it was difficult. So it is difficult for parents at the beginning, but I would also, you know, add to what you just said as far as like pushing through, you know, pushing through that fear, because at the end of the day, it's going to help, you know, the child. And there's no limits, especially with today's technology and so many different treatments out there. There's so much that, you know, a child can actually gain. You know, from actually having these resources and services. So I know that you do have a private practice. So how can people find you?
So they can definitely find me online.
Yes.
At www.speechandaccent.com.
Okay.
Or they can call my phone, which we can list on your podcast.
Absolutely. We'll go ahead and list all that information on there.
Definitely connect with me. Like I said before, we offer free consultations.
Yes.
We are located on Harrison Street in Princeton.
Okay.
So we provide both in-office and online therapy.
Okay.
I am licensed in Georgia, Florida, Trinidad and Tobago, and New Jersey. And very soon, when we do have the compact states, I will be licensed in many other states as well.
Yeah, so that would be awesome.
There's
where
no
people
distance.
could actually, where people can actually find you.
Yeah.
Yes. And what's the name of the business?
It's Global Speech and Language Therapy.
Yes.
And I had forgot to mention that I also work with adults who have issues with foreign accent reduction.
Yes.
So I work with individuals who want to improve their English pronunciation skills and do more corporate business speech therapy.
Wow.
Or individuals who have trouble with telling their own story. We work on narrative skills as well.
Wow.
With individuals who have experienced trauma, adults.
Okay, Dr. Moore. Oh my goodness. We've had a wealth of knowledge here.
It's a pleasure being here.
Yes, lots and lots. And I definitely thank you so much for taking time out of your busy schedule to be here and just pretty much enlighten us on so much information. I know that this topic could just go on, and there's just so much information, you know, so hopefully, you know, people can actually find you. We'll definitely put all the information, you know, in the notes of the podcast, so like that they'll be able to find you. And again, it sounds like we're talking about from children. You start out from ages for you at your practice. Is there any 2.5, all the way up to adults? So there you have it, guys. So if you're trying to actually, you know, work with your child or have her work with your child or yourself as an adult, you know, it sounds like Dr. Moore has a lot to offer. So thank you so much, Rowena, for coming and being part of today's podcast and enlightening us and providing so much wealth, you know, with your knowledge and all your experience. And hopefully we'll see you soon, you know, in another podcast. So thank you so much. To our audience.
To be here.
Yes, thank you. We definitely appreciate it. And thank you to our audience that's out there. It was a pleasure being here again with Soul Conversations with Z, Healing in the Raw. Until next time.